we continue our investigation of the evidence for and against the use of herbs in relieving perimenopausal symptoms. As a herbalist, I use plants containing phytoestrogens, plant estrogens, to support women who don't wish to use menopause hormone therapy. These herbs include herbs like Dong Quai, known in traditional Chinese medicine as Dang Gui. In this video, I've scoped the literature on the efficacy, safety, and mechanism of action for this ancient herb in order to answer the question, does Dong Quai relieve symptoms of perimenopause, and how should you take it for the best effect? Hi, I'm Sue Lin, a naturopath and herbalist, and I love sharing information about complementary medicines, diet, and lifestyle practices that can support your health in midlife. I teach in naturopathic degrees, and I'm currently doing my doctorate in research into women's health. If you'd like to tune in more often and support my work, please click on that like and subscribe button and stay tuned for more in-depth videos on natural healing for women. Back to Dong Quai. Dong Quai is a traditional woman's herb used for female conditions. It's particularly used to manage the menstrual cycle and bleeding. The active chemistry in Dong Quai that improve menstrual health includes organic acids such as ferulic acid, which is antioxidant, anti-inflammatory, and antimicrobial. Phthalides like Z-ligustilide, Angelica polysaccharide, APS, which boosts the circulation of blood and enhances immunity, as well as more than 165 chemical constituents that have been identified in this plant over the past 50 years, such as fatty acids, terpenoids, alkaloids, and aromatic compounds. Being less extensively researched than many of the other herbs that I've covered in this series, it was difficult finding much above a level 1 grade of evidence. And in the studies I did find, there were issues with the method of prescription, preparation, and the dosage used, along with small participant numbers. Evidence for no efficacy was found in 2 systematic reviews. However, there are issues with both of these to consider. In a 2003 systematic review by Huntley and Ernst, only 1 clinical study of Dong Quai was considered. Although a systematic review is a high level of evidence, it's not possible to completely confirm or refute the efficacy of a medicine from 1 trial alone. This is primarily an issue of not having enough studies that meet the requirements to be included in a systematic review. Furthermore, reviews like this are more reliable if multiple reviewers look at the evidence to reduce the risk of bias and error. This review had only 1 mentioned, perhaps 2 at most. There was a 2007 systematic review of 58 randomized controlled trials. This review also managed to include only 1 clinical study for Dong Quai, which dated back to 1997, and it tested the efficacy of Dong Quai in postmenopausal women for vasomotor symptoms, showing no efficacy. There's one important point to consider here. The effectiveness of Dong Quai is not about its estrogenic action alone. It enriches and moves blood, particularly in menstruation. Postmenopausal women do not, and ideally should not, have menstrual bleeds. So it makes me wonder, would the results have been different if the participants were younger women who were still cycling? With these 2 systematic reviews, we can't say that Dong Quai relieves vasomotor symptoms, but with limited studies interrogated, it's difficult to say this with certainty. Many Eastern trials have focused on Dong Quai's ability to manage ovarian insufficiency, POI. POI affects just over 1% of women and involves ovarian failure before the age of 40, which means infertility, and a quicker march to menopause. This includes a 2018 experimental study using Ursian decoction, and also a 2024 systematic review using the same formula. In this review of 15 clinical trials, the formula worked best in conjunction with menopause hormone therapy. It significantly increased estrogen, lowered follicle-stimulating hormone, and lowered luteinizing hormone compared to just using menopause hormone therapy alone. In effect, it reversed the general hormone trajectory of menopause, and the results were statistically significant. Another study, 2019 experimental study using Bushun horseshoe decoction, another formula containing Dong Quai, where all 20 participants experienced a decrease in FSH and LH. There was also an increase in estradiol and a reduction in menopausal symptoms. Further, a 2022 systematic review of Chinese herbal medicines for the treatment of POI found that they were generally beneficial. This includes formulas using Dong Quai. Another study, a 2022 study, which found statistically significant improvements in psychosocial, physical, and sexual aspects, as you can see in this table of results. Taking it up a level, beneficial effects of Dong Quai containing formulae can be seen in a 2026 open-label clinical study using a combination of not one but two Dong Quai formulas together for menopausal symptoms over 3 months, which led to positively improved estrogen levels and reduced FSH levels. Results were statistically significant, but always a but. The participants were aged 30 to 40, too low, in my opinion, to be applied to the majority of perimenopausal and menopausal women. Western evidence on Dong Quai for menopausal symptoms is mostly inconclusive and suggests limited efficacy. Why would this be the case with a medicine that has been tried and tested over hundreds of years? Here are some things to consider. Dong Quai doesn't present well in efficacy studies because of the short duration of trials. Most are 6 to 12 weeks long, which doesn't reflect the real-world reality that women take these herbs for much longer. Next, Dong Quai is an Eastern herb, so it's usually prescribed in a formula where it works synergistically with other herbs. It is not used alone as a mono or single ingredient medicine. Traditionally, it's combined with astragalus for menopausal symptoms in the women's formula Dang Gui Bu Xiu Tang. Note that Xiu means blood. It's part of the formula name. Blood is a big part of Dong Quai. First documented over 800 years ago, this formula stimulates qi and enriches the blood. Other combinations are with Rhamania root, Rhamania glutinosa, for stagnant blood in menstrual cycles or skipped periods, and with corydalis for painful menstruation, as well as with cinnamon for rheumatic, muscular, and joint pain. Another formula with Dong Quai is Dang Gui Liu Huang Tang. This formula is used to manage perimenopause symptoms, like night sweats, within a pattern of yin deficiency. Knowing that Dong Quai works best in formula combinations, this may be why the studies I earlier mentioned using Dong Quai and formula tend to have positive results compared to those in the West using Dong Quai alone. And what about using Dong Quai then in formulas in Western herbalism? Rotem and Kaplan ran a study in 2007 which used a combination of black cohosh, chase tree, American ginseng, red clover, and St. Mary's thistle, together with Dong Quai to treat hot flashes and night sweats. The women taking the formula with Dong Quai experienced a significant reduction in menopausal symptoms compared to the placebo group. By the 3rd month of treatment, there was a 73% decrease in hot flashes and a 69% drop in night sweats, as well as improved sleep quality. 47% of the women taking the formula saw a complete cessation of hot flashes compared to 19% in the placebo group. So promising results there. A 2007 review of studies by Chima et al. And a 2025 by Chavda et al. Found Dong Quai less effective, however, than black cohosh and red clover for the relief of hot flashes. It's not my first pick for hot flashes and night sweats, but if I see weakness, debility, poor blood status, then I would consider it. See my videos on black cohosh and St. John's wort for better efficacy results for hot flashes. Another reason for the variability in study results is dosage. Herbal dosage is different to pharmaceutical drugs that tend to have a standard dose based on a single ingredient approach. Dong Quai is a herb that works together with other herbs for a holistic effect. The 1997 study used a dosage of 4.5 grams dried root of Dong Quai daily. It wasn't ideal to use Dong Quai alone, but understandably, This does suit the randomized controlled trial design best. Also, with the standard recommended dose of up to 10 grams daily in Chinese medicine, a dose of 4.5 grams is definitely on the low side. There may be issues with our understanding of Dong Quai in the West that question whether we're really using it as effectively as we could be. In 2014, the Ireland-based scientist Professor Ingrid Hook wrote an article titled Dang Gui to Angelica sinensis root: Are potential benefits to European women lost in translation? She identified several aspects of transposing a medicinal plant from one culture to another that could lead to ineffective usage. These included understanding of the phytochemistry in the plant, the method of processing used. With Dong Quai, historically, it's processed by smoke drying, stir frying, with or without wine. Biological differences in the recipients, Western women compared to Eastern, as well as the potential to interact with drugs commonly used in the West, but not so frequently used in the East. Look at this image here. It shows the transcript of the original and first documented recipe for Dang Gui decoction, specifically that formula, Dang Gui Bu Xiu Tang. And there is the use of cooking with honey and wine and the preparation as a decoction. This is so different to powdered root of Dong Quai given as a tablet or a capsule in the West. Study design, use in formulations, dosage, menstrual activity of participants, preparation method, many of these factors could explain why Dong Quai doesn't always show as effective in Western studies for the relief of menopausal symptoms. Furthermore, researchers have identified genetic differences in enzymes between Western and Eastern women, particularly the CYP450 group that break down medicines. Professor Ingrid Hook also explains that many Chinese trials don't meet the inclusion criteria for a systematic review in the West due to the difference often in diagnosis and prescribing, so they weren't even considered. I found a lot of research on the safety of Dong Quai in women with breast cancer. However, with so much to discuss, I have shelved that data for a future video. For now, this is my takeaway. The evidence for safety is not mature enough to say with certainty that Dong Quai is safe in hormone-sensitive cancer, endometriosis, uterine fibroids, or other estrogenic conditions, so avoid. The other option would be to ensure that you're being managed by a Chinese herbal medicine practitioner and treated with a unique formula. This enables the practitioner to tweak the formula to fit you and to add specific herbs in there to reduce any risk of adverse effects. This is something that happens in Chinese medicine formulas anyway, so it's nothing new. And who else might Dong Quai be unsuitable for? Dong Quai has a fair amount of drug interactions and should be avoided with blood-thinning medications like warfarin, antiplatelet drugs, including aspirin, non-steroidal anti-inflammatory drugs, NSAIDs, and avoid with any supplements that thin the blood, including ginkgo or fish oils. Avoid Dong Quai if you're pregnant. Other cautions with Dong Quai stem mainly from two of the herb's energetic qualities. It's warm and it's moist. These qualities mean you should avoid Dong Quai if you tend to bleed easily, have chronic diarrhea, if you're yin deficient with internal heat, or just deficient in yin, which is so common in menopause and postmenopause. According to my acupuncturist Jamison at Magic Turtle Acupuncture in Avalon, women on menopause hormone therapy may want to avoid using Dong Quai formulas because it can amplify the effect of their menopause hormones. So what do I think about using Dong Quai for perimenopause symptoms? The evidence does support its use in combination with synergistic herbs to effectively increase estradiol and lower FSH and LH. This would have the effect of staving off the menopause. Studies conducted in the West don't support its use on its own. However, issues around the use of using Dong Quai alone, the dosage, etc., have likely contributed to a low evidence level in the West. In Eastern studies, the evidence is more compelling, and ultimately the best way to use Dong Quai is in formulas. So if you're looking at using it, you're best off seeing a Chinese herbalist. Don't reduce Dong Quai to its chemistry. See it as a player within an orchestra of herbs, and that is where this herb really sings. So who would benefit from using Dong Quai? It's a great woman's tonic herb. It can be helpful with all things hormone health for women, but its specialty is in its ability to enrich and strengthen blood. So first up, if you feel weak, if your cycle is irregular or completely missing, if you have a pale complexion, low iron, anemia, menstrual issues, menstrual pain, this could be a good herb to consider. In my practice, I've used this herb to assist in restoring normal bleeding cycles in women with amenorrhea, no periods, and women with painful and irregular periods. It relaxes the uterus, gets the blood flowing, especially where there might be stasis. Its daily dose from a Chinese medicine perspective is 6 to 10 grams daily, and from a Western herbalism perspective, the daily dose is 3 to 9 grams daily. I hope you enjoyed this video on Dong Quai. Don't forget there are others in the series. You can check out the evidence for black cohosh and St. John's wort as well. Stay tuned for more videos on herbal medicine. Have a beautiful day. Take care of yourself.